subsidies are at risk of disappearing. From USA Facts Analysis 2025 shows how the Affordable Care Act subsidies helped reduce the national uninsured rate to its lowest level in over a decade. Most Americans rely on employers' insurance, some rely on marketplace. The elimination would raise the premiums of many citizens, affecting those who are not even directly enrolled in the Affordable Care Act plans. These impacts have consequences, which include significant increase of uninsured rates and having higher health care costs overall for insured and uninsured individuals, and have severe financial load for many citizens. The ending the subsidies would impact the uninsured rate and prevent access to care. It would also affect the cost of hospitals and emergency stays in insured individuals, and it would also affect vulnerable populations, including elderly, low-income adults, and also people living with chronic conditions. The first major impact of elimination would be the expected rise in rate of uninsured in population, and also to prevent access to care. According to USA Facts on November 2025, about 45 million people are enrolled in the Affordable Care Act plans, and about 14.5% uninsured people went down to 8.6% since the expansion of healthcare access. This shows that the subsidies improved the affordability and accessibility. If they were removed, people would have no coverage, lose their coverage, and plans would be too expensive for them. This leads me to how the financial burden would affect many populations. According to CBS News in 2025, reports that millions of citizens face unaffordable premiums, and also CNCB September 25, Urban Institute, Robert Wood Johnson Foundation, found out that health insurance premiums would rise by 7% if subsidies are eliminated. Due to all of this, the unaffordable premiums would leave emergency care to be too expensive, and this is affecting insured people as well. This would change the shift of how hospitals work. The financial burdens would not just affect everyone, they would most affect vulnerable populations in certain groups, which leads me to how people who have low income, elderly groups, and people living with chronic conditions end up facing more impacts during the situation. According to the Pew Research Center in 2025, said most Americans believe that private insurance companies had excessive influence over health care policies, which hold public concern. The elimination of the Affordable Care Act premium taxes would increase of the out-of-pocket money people would have to pay, and this is affecting the low income and middle income people, which is affecting affordability for these vulnerable populations. To review, the uninsured citizens would increase the rate of preventing access to care, would also increase. The cost would especially affect for emergency care, and also have the greatest impact on vulnerable populations. The elimination of the Affordable Care Act has impactful consequences, which include a significant raise in uninsured rate and having high health causes overall for insured and uninsured individuals and have severe financial load for many, many citizens. The evidence is one point super clear that the Affordable Care Act would push millions away from accessibility and affordability.